So welcome everyone. I'm Adelina Comas-Herrera. I'm delighted to welcome you to this webinar of the interest group on care home regulations. And just to say, we have a smaller webinar today. We know it's a school holiday in many countries, and we didn't realize that at the time, but we're very happy to have recorded this webinar. And so I'm going to start by introducing the Global Observatory to Long-Term Care. Some of you have heard this before, but it's good that we tell you also about our next webinars. So the Global Observatory of Long-Term Care is a platform for cross-national learning to improve and strengthen care systems. It's all about sharing our knowledge, what we're learning. It's about identifying key challenges and how different countries are addressing them, share research evidence, facilitate collaborations, and you're all very welcome. It's free to become a member, and you can join. When you do that, you can join interest groups, so you can also suggest new ones, and that way you can find people with similar interests, share your publications and your knowledge. We have a QR code in case you aren't a member yet, but I think many of you have already joined us. So our next webinar is after today is on the 3rd of March and is on quality in long-term care, on thinking about frameworks and approaches. This will be involving also the World Health Organization, because they're looking very much at this topic. We then have another one from this interest group on ownership, asymmetric information, and quality of care for older people, evidence from US nursing homes during COVID. And the presenter, Leonid, is actually here on the call. Very nice to see you. And we then have one more from a different interest group on community-based approaches to dementia. And this is going to be looking at dementia meeting centers, their development, evaluation, and the dissemination of this model. And there's a few more coming up in the next few months. We're getting very busy, and we're very happy for this excellent take-up. So it's my turn now to introduce Igor Shagalov, who is leading this interest group and who will introduce today's speaker. Thank you.
Thank you, Adelina, for your presentation. And yeah, let me launch my slides. Just a couple of words about our interest group. So I'm pleased to welcome all of you to fourth webinar of Care Home Market and Regulation Interest Group of the Global Observatory of Long-Term Care. Thank you very much for joining us. And just a few words about our group. So the goal of the group is to share knowledge about policies that improve the quality and outcomes of care in care homes. And we do this by working together with academics, policymakers, practitioners, and providers. We focus on different ways to organize care markets and study how these approaches affect care quality and costs. And to achieve this goal, we will hold regular webinars to share evidence and have live discussions with experts. And additionally, we aim to spread the knowledge we gain beyond our group, and that is why we welcome you to share your publications and materials about care homes and regulation with us. How can you do this and keep up to date with the group? So it's very simple. Here there are sequential steps. There's 3 simple steps to do this. First step is to register on the observatory website. The link can be seen on the screen. And the second step is to tick the box for our group during registration. And finally, the optional third step. And if you're already registered on the observatory website and would like to join us, you can just simply fill out the application form on the group page itself. And of course, we look forward to having new members in our group. And we would appreciate it if you could share with us your ideas for the future webinars, topics that you would be interested in considering. And you can do this in the chat or during the webinar or by email, up to you. A few words about their steering group. Jose Luis Fernandez, the Director of Care Policy and Evaluation Center. He's absent today. So Adelina Comas-Herrera, Assistant Professorial Research Fellow, Care Policy and Evaluation Center. And I, Igor Shagalov, Research Associate at Care Policy and Evaluation Center, Research Fellow at the University of Birmingham, and the interest group lead. And now let me say a little about the topic of today's webinar. One of the distinctive features of the long-term care market for older people is that it presents challenges for service users who often struggle to assess service quality and make informed choices due to increasing demand and market fragmentation. And this is particularly the case in care homes, where the information asymmetry between care recipient and care provider is more pronounced than in other market sectors. It is therefore important that care homes are accountable to the client, and accountability allows older people and their families to judge the quality of care, and thus motivating the management of care homes to make sufficient effort to provide it. And today our distinguished speaker will tell us how accountability mechanisms work in Spanish nursing homes and what factors determine them. So I'm very pleased that Ixchel Perez Duran from Autonomous University of Barcelona have agreed to present the paper today on the upward and downward accountability mechanism in nursing home services. And now I would like to turn the floor over to our dear speaker, Ixchel, please. The floor is yours.
Okay, thank you. Thank you very much, Adelina, Igor, for the kind invitation to present this seminar. I am Associate Professor in the Department of Political Science at the Autonomous University of Barcelona. My research lines are mainly focused on topics related with governance, public policies, regulation, transparency, accountability, and trust. And today I will be presenting a recently published paper co-authored with Stephan Grimmelikhuijsen from Utrecht University, a paper that has been published in the journal Public Management Review. This article, I would like to emphasize that is part of two research projects that I am coordinating, funded by the Spanish Ministry of Science and Innovation, in which we are analyzing accountability, transparency, quality, and discrimination in nursing home services. So this paper is part of one of these two research projects. And the topic of the paper is, as Igor said, it's focused on accountability. So what's the background of our study? What we argue in this paper is that an aging population and the devastating consequences of COVID-19 for nursing home residents highlight the need for having more transparency and accountable nursing home services. In addition, we argue that the closed-door environment in which these services operate emphasize the need for accountability with the aim to prevent neglect or abuse, and also with the aim to improve the quality of the services. So this is the main idea that we have in this project. And we also emphasize the need for more accountability because these services are characterized, as Igor said in the presentation, by having high levels of information asymmetries between providers and beneficiaries. So the paper is focused on accountability in nursing home services. And what I would like to clarify is the conceptualization that we use by accountability. We use the concept developed in public administration and public policy, where accountability is understood as a relationship between two sides or two types of actors. An actor who provides information and justification about their decisions and actions, and the demand side, that is the actor or the forum who evaluate and control these decisions and actions. So we have these relations between actors and forums of accountability, or two sides of accountability, a supply side and also a demand side. When we talk about accountability relations, we can talk about different actors in charge of providing information, or in charge of receiving this information, or in charge of evaluating this information. It could be government, service providers, the facilities, managers of the facilities, workers, or the direct beneficiaries or the relatives. In this paper, we focus on the accountability relationships that are developed between nursing homes and the relatives of nursing home residents. And in particular, we analyze two types of accountability mechanisms that have been highlighted by the literature in public administration, that are downward accountability mechanisms and upward accountability mechanisms. What's the conceptualization that we use for downward accountability? For downward accountability mechanisms, we analyze the extent to which family members directly receive information, but about substantive aspects of the services. So the extent to which the relatives receive more information, so it's something that we analyze and measure in this paper. As for upward accountability mechanisms, we analyze the extent to which family members perceive services to be subject to control mechanisms put in place by public authorities. So the second dimension, upward accountability, is the perception about to what extent public authorities or to what extent governments are controlling and overseeing these services. In this paper, we analyze these two types of mechanisms, and we also analyze what is the convergence between the variables that affect these two types of mechanisms. The main research question of the paper is what are the determinants of downward and upward accountability mechanisms perceived by the relatives of nursing home residents. And what are the determinants that we investigate? So we follow the literature on nursing homes, the literature on accountability and transparency, and we identify potential mechanisms that can improve or that can affect the accountability perceptions. So we investigate the effect of different types of ownership of the facility. We also investigate the effect of the vulnerability of the residents. We also investigate the level of knowledge of the legal framework that the relatives of the nursing home residents have. And we also investigate the effect of the COVID-19 crisis as a contextual variable that can affect these perceptions on accountability, and also another contextual variable that refers to the legal development of transparency requirements of the regional governments in Spain, because this study is focused on Spain, and I will be explaining how we measure all these dimensions. I will start by presenting the research strategy, and then I will be presenting how we measure the dependent variables and our hypothesis and the analysis and results. But the research strategy is important because we conducted a survey in Spain in December of 2022. To my knowledge, this is the first study that have conducted a survey in all the Spanish regions. And in Spain, the level of government that is responsible for implementing these services are the autonomous regions. The regional governments called autonomous communities. They are responsible for providing and regulating these services. And we conducted a survey with the relatives of residents, direct relatives, that is, individuals that have a mother or father living in a nursing home. Our survey was administered by the Cantar company. It's a panel company, a very well-known panel company. So they distributed our survey to their panel. The filter question was if they had a mother or a father living in the nursing home, and in the case, because we identify some cases in which they have two of them living in nursing homes, so they selected one of them. So the respondents belong to all the regional governments, to the 17 regional governments. And another issue that I would like to emphasize is why we decided to focus on relatives instead of direct beneficiaries. And this project was closely followed by the ethics committee of my institution. And since the pandemic was very close, and because there are some psychological issues associated with this episode, so we decided to target relatives instead of direct residents. So we also conducted cognitive interviews with associations of relatives of nursing home residents with the aim to identify if the survey was clear for all of them. And the survey was conducted in December 2022, and the respondents are 1,000 respondents across all the 17 regions. I would like to emphasize also the quality of the survey, because this is something that we have been clarifying in our publications. So our survey reflects the diversity of beneficiaries in Spain. So for instance, the distribution in terms of the type of ownership of the nursing homes is the following. So in our survey, we have 38 respondents that have a mother or a father living in a public nursing home. 31% of them live in a private for-profit nursing home, 13% in private non-profit nursing homes. And in our survey, we also included a question that was that we asked if they can distinguish between private for-profit, non-profit, but we also included another item, another category that was unaware whether it is for-profit or non-profit. So we have 18 or 19% of our respondents that are living in private nursing homes, but they are not able to distinguish between for-profit or non-profit. The actual distribution of private and public facilities in Spain is 70% are private facilities and 30% public facilities. So our sample closes this de facto distribution. Our survey also mirrors the distribution across regions. So for instance, these are the 17 autonomous regions in Spain, and we gather responses. For instance, 16% of the respondents were from Catalonia, and another 17% from Madrid. So the distribution also mirrors the actual distribution of the beneficiaries. We also try to have variation in terms of the location of the nursing home. So 36% of our respondents are living in nursing homes located in large cities, 27% in small or medium-sized cities, and 12% in villages. We also have distribution in terms of gender and also in other variables such as the income of the household of the respondent. So, and I am showing this data just to clarify that we have this important distribution for our study. Okay, and then I would like to clarify, so we have two dependent variables. One is downward accountability mechanisms, that is the extent to which family members directly receive information about substantive aspects of these services. And we follow the literature on care, and we followed on a Bayesian classification about information on the structures of the services, processes, and outcomes. And we identify 18 items that belong to structures, processes, or outcomes. So we included 18 questions, and we asked relatives if the nursing home provides information about, one question was about the staff ratios. Another question was about if they receive information about the individual care plan. Another information was related about if they receive information about public inspections and so on, the menu, the activities, and we have 18 items that are included in the paper if you are interested. And as I mentioned, these items belong to 3 dimensions of the quality of the services: the structures, the evaluation or outcomes, and the processes. We ask the relatives if they receive this information or no. So we coded 1 for those that respondent that they receive this information and 0 for those that do not receive this information. We know that we could include more complex questions about the amount of information they receive or the characteristics of this information, but with the aim to simplify, we decided to include yes or no. As for the second dependent variable, that is upward accountability. So as I mentioned, the conceptualization that we have is the extent to which family members perceive services to be subject to control mechanisms put in place by public authorities. And this measure is based on one question of our survey. In our survey, we ask relatives to what extent do you consider that the public administration conducts evaluation or controls to the nursing home? And we use different categories, 5 categories of responses that go from not at all to completely. So in this way, we measure these 2 dependent variables, one that is an index on the amount of information that they receive, and the second one that is the perception about the extent to which relatives perceive that regional governments oversight the nursing home in question. Okay, and as I mentioned at the beginning of the presentation, according to the literature, because I have been conducting research on accountability, and according to research on accountability, we were interested in analyzing the effects or the conditions that affect these perceptions on accountability. And the first variable or the first hypothesis that we have refers to the type of ownership or the type of funding of the nursing home, because from previous studies in public administration, we have evidence that private for-profit facilities have more shortcomings in the provision of the services and also in the control of the services and in the fulfillment of regulations. And on the basis on these previous studies, our expectation was that family members of residents in public and non-for-profit facilities will perceive higher levels of both upward and downward accountability compared to those of residents in private for-profit facilities. Since we also identify that we have variation not only in terms of the ownership, but also in terms of the type of place that these individuals could have. Some of them could be publicly funded, fully publicly funded, but some residents are living in private nursing homes and these places are publicly funded. So we also contribute to the studies by including this distinction, not only in terms of the ownership of the facility, but also in terms of the place that, or the bed that the residents have. And we also follow the literature on accountability, and we try to investigate whether vulnerability of the resident has an effect on different types of perceptions. And in particular, we expected that family members of disadvantaged residents, and by disadvantaged residents, we understood those with low levels of incomes, the socioeconomic dimension, but also we understood as disadvantaged residents those that have higher levels of dependency. So we investigated whether this profile, lower incomes and higher level of dependency, affect the perception of the accountability received. And another dimension that we analyzed was the COVID-19 response, because we conducted the survey in 2022, very close to the pandemic, and we expected that those nursing homes that had a better response, that this will contribute to better perceptions, and actually this is something that we demonstrate. And there are 2 more hypotheses. One that is the level of knowledge of the legislation of the relative of the nursing home resident, because according to previous literature, we know that the more knowledge you have, the more critical you are of the information that you receive. So we expected that if relatives know more about how the legislation works in each one of the regions, they will be more critical against the information that they receive. The last hypothesis refers to the formal transparency arrangements, because as I mentioned, this is public policy that is responsibility of the regions, the regional governments in Spain. So we identify, we measure the level of development on transparency measures stated in the laws, in the regional laws. And we analyze to what extent this level of development of the laws in terms of transparency of the services, to what extent these formal obligations also affect the perceived performance of accountability. So now I will explain how we conducted the analysis. As I mentioned, we analyze variables that are placed at different levels, macro level variables that refers to the COVID-19, the formal development of the rule, meso level variables that refer to the characteristics of the facilities, the nursing homes, but we also included some variables that refer to the individual level, in particular characteristics of the residents of nursing homes. As for measuring the type of nursing home, we included in our survey a question that allows us to identify whether the relative was living in a public nursing home, a private for-profit, private non-profit, private but unaware whether it is for-profit or non-profit. We also included another question that refers to the type of place or bed that the individuals have. Fully public facility, private nursing home with a publicly funded bed, or fully private facility. As for the performance during the pandemic, we also included a question that asked relatives to what extent they evaluate the response given by the nursing home. And as for social disadvantage or vulnerability, we included two questions. One that in which we obtain the level of public subsidy that the residents receive, because the public subsidy is correlated with the level of income of the residents. So we included this measurement as an approach to identify the socio-economic status of residents. And we also included another question that refers to the level of physical vulnerability, the extent to which individuals require help with the daily activities. Limited autonomy. We also included two more questions. One question about the level of knowledge. This is perceived level of knowledge. We ask relatives to what extent they know about the legislation in the respective regional governments, and they responded this. This is, as I mentioned, a perceived level of knowledge of the legislation. And as for the formal transparency in each one of the regions, this is part of another paper that we published in which we measure the legal obligations across the 17 regions. And according to the law, we calculated an index in terms of to what extent the regional governments include obligations to provide more transparency of the services. And we also included this variable of formal transparency. As for the control, so since we conducted interviews with the relatives, and we also interviewed some people working on the topic, we included different controls that we thought that are necessary for our study. We control by the size of the nursing home, by the location of the nursing home. As I mentioned, if the nursing home was located in a big city, a village, or some other categories that we included. We also control by characteristics of the nursing home resident, the age, the sex, if they have previous experience in other nursing homes, or the period of stay in the nursing home. This figure shows the results. So the figure that is in the first figure shows the results referring to downward accountability, and the second one for upward accountability. And as you can see, I will explain later each one of the results. But what we can see is that the direction of the variables are the same for both types of accountability. And this is something that in terms of accountability literature, we wanted to demonstrate to what extent these dimensions have the same effect for two types of mechanisms that which purpose is different. One that is targeted to the beneficiaries, and the other type of accountability that is targeted towards governments. I will explain each one of the conclusions. So as I mentioned, the first conclusion is that downward and upward accountability mechanisms can complement each other. So we could have control exercised by governments at the same time that control implemented by the relatives. But of course, this is something that we this is in the context of nursing home services, so we cannot extrapolate to different services. But in terms of nursing services, these two types of mechanisms complement each other. As for in terms of the results for upward accountability mechanisms, we identify higher perceptions of accountability, higher perceptions of control among relatives in public facilities and with publicly funded beds or places. And this is something in line with previous studies in public administration that have found shortcomings in terms of accountability and transparency by private for-profit organizations. So what we demonstrate is that relatives perceive higher levels of control when their relatives are living in public nursing homes. We also identify that individuals perceiving more knowledge regarding the functioning or the legal framework that regulates the services, they tend to provide more positive assessments of both types of accountability. So the more knowledge the relatives perceive they have, so also the perception is positive. So, and we were expecting the opposite. The more knowledge about the legislation, we were expecting more negative perception about the accountability that they receive, but we found the opposite. So the more knowledge, the more positive their assessment. A variable that is highly significant is the impact of the COVID-19 pandemic. And for both types of accountability, upward and downward accountability. What we found is, as it is expected, that a better response to COVID-19 is associated with higher levels of perceived accountability towards the relatives and also towards public authorities. As for the other hypotheses that we test, we didn't identify any significant result. So these are the results that we obtained with this analysis. Well, I would also like to mention that this paper is part of two projects that I am coordinating, funded by the Spanish Ministry of Science, and in which we are investigating some other dimensions of the governance of the services, because I am a public administration scholar. So we are investigating trust and trustworthiness in nursing home services. We are investigating different dimensions of trust, the benevolence, integrity, and performance. And in particular, we are interested to what extent these different measures that we obtain from transparency and accountability have an effect on the level of trust perceived by the relatives. And this is a paper that is already in submission. We are also working on another paper about the effect of different regulatory arrangements. So to what extent different regulatory arrangements are more likely to enhance trust by relatives. And for this paper, we included a conjoint experiment in the survey, and this is something that we are investigating. Another article that we are working on is one on the performance during the COVID-19, because we want to investigate the variables that affect. I know that Adelina has done a lot of research on this, but we are also interested in analyzing what happened in Spain, in particular with the relatives. And we are also working on two dimensions of the services that we are very interested. One is discrimination in the access in terms of the vulnerability. So we are interested in analyzing to what extent different levels of vulnerability are a condition to be discriminating in the access of these services. And we are also analyzing the consequences on trust in the use of artificial intelligence tools or roboticization in the services. And last year, we conducted a second wave of the survey in Spain. We couldn't interview the same relatives due to some constraints by the panel companies, so the respondents are different from the first wave, unfortunately. But in June, we will be conducting the third wave of the survey with the same respondents that we had in the second wave of the survey. And one of these projects is also focused on a comparative perspective. So we are interested in analyzing some other countries in Europe. So that could be very interesting for us. And then the last slide. I would also like to mention that this paper that I published with Stephan is also related with a present paper that I also published with Alfredo Hernandez, in which we investigated the messages used by governments, firms, business associations, and associations of relatives of nursing home residents. So we investigated the topics they talk about in the social media with the aim to what extent we was interested in analyzing if there is a convergence in the messages that they use. And our main result is that there is any convergence in the messages used either by the providers or the beneficiaries or the government. So thank you very much. The last slide is just to say thank you for your attention. I will be more than happy to respond your questions. I have flu, so my voice is not very well, but thank you very much.
Thank you very much, Ixchel. Thanks a lot for the very interesting and thought-provoking presentation. I think we can move to question and answer session, and we're meeting in a small circle today, and that is a kind of advantage. We'll have plenty of time to discussion the paper as usual, and that is great, I think. So yeah, please, I see the first hand. Please raise your hands if you have a question. Adelina, please.
Yeah, that was fascinating and very interesting to see this agreement between the two types of accountability mechanism. Not very surprising that you found this higher the perception of accountability of the public system or public sector. I'm sorry if I missed it, but did you find any geographical differences and that may relate to different regulatory approaches in different regions in Spain?
No, actually, we expected to find differences because there were some scandals in some regions, such as in Madrid, or particular in Madrid, and we expected to find differences, but we didn't find differences. So we included the regions as control variables, and we didn't identify any difference until now. So, but we will still working on this.
Thank you.
Thank you very much, Adelina. Yep, Leonid, please.
Thanks very much. It was a fascinating paper, and First thing is, if you can please give us the reference to this paper one more time, perhaps in the chat. As far as I understand, it's published, something I would like to have. I have a question and a comment. The question is, you said that upward and downward accountabilities can complement each other. And what do you base this conclusion on? What evidence do you have to suggest that they complement empirical evidence? That's the question. And the comment would be that, in my opinion, it would be also extremely interesting to reverse the position of your dependent and independent variables. As far as I understand, in your analysis, accountabilities are dependent variables, and you explain different levels of accountability by a variety of controls and characteristics of nursing home. I'd be quite curious to see if accountability of both types would influence nursing home outcomes, because as you mentioned, there is considerable asymmetry in the nursing home sector, and accountability is a means to overcome this asymmetry. So why wouldn't you consider, for example, COVID-19 outcomes, death rates, whatnot, and then try to explain the variations by different levels of accountability? And in that case, you can give a very precise meaning to these statements that different types of accountability can either substitute for each other or complement each other, because you can ensure quality either by government inspections, which is vertical accountability, or by relatives control, which is horizontal or downward accountability, and how the two interplay. I can mention a couple of papers. I don't want to take other people's time, but if you like, there were a couple of papers based on US nursing homes, which showed that openness of nursing homes to relatives is a very important factor of their performance before COVID and during COVID. So if you want, I can send you some references. Both papers were published in the Journal of Health Economics. Thanks.
Thank you very much, Leonid, for your comment. Very, very helpful. So we are working on two papers, and one is on trust in the services. And we measure a general assessment on trust, and we also measure to what extent they perceive the performance of the nursing homes, the benevolence, the integrity. And well, we use different questions that I don't remember now, but with the aim to measure these three dimensions: benevolence, ability, and integrity. And we use these measurements on accountability as explanatory variables. So in that case, our dependent variables here are the independent variables for explaining trust in the services. And as for the COVID-19 response, we also include this as an explanatory variable. So we expected that a better response was related to more accountability and transparency. And as for the openness to relatives, so this is something that we are also very interested. So the papers that you mentioned would be very useful for us, because in the paper that we are working on trust, we identify that more involvement of the family members, the more involvement they have, the more trust they have. And in this way, this is opposite to the expectation that nursing homes prefer relatives to be distant from the management. But in this paper, what we found, and the paper is in submission, what we found is that the more involvement of the relatives, the more trust, not only in the performance, but in the three dimensions, not only in the general perception on trust, but also in the different dimensions of trustworthiness. So that's why this is also very, very interesting. So thank you very much for your helpful comment. I will send you the references. Yes.
And I will send the papers which I mentioned.
Thank you very much.
Thank you, Leonid. Thank you, Ixchel. Any other questions, comments, please? Yeah, Cassandra, please.
Thank you so much for your presentation, Ixchel. And I hope that I'm not asking a question that you've already touched on. I have to admit, I've been tuning in, listening in the background. But I was wondering then, as you also had controlled for the extent of knowledge that relatives have, I wonder then if you also saw a bit of a selection effect in the sense that perhaps, more informed care relatives might have been more inclined to have the relatives go into certain types of care homes, perhaps more publicly provided rather than privately provided, and whether you thought that maybe, from what I saw from your results, you didn't see too much of a difference for the downward accountability, but you saw some differences perhaps in a bit for the upward accountability. So I'm wondering then if you think that maybe that might play into some of the results that you saw.
But sorry, I couldn't understand the first part of the comment. So about
so my comment was about perhaps selection effects of relatives that, it could be the case that more informed relatives that know more about the care system, that do a bit more research about the care homes, then have their or their relatives go into certain types of homes, and that these can be congregated perhaps against publicly provided homes. So I'm just wondering if you gave that a bit of consideration, and if perhaps some of the minor differences you might see here might be a result of selection effects.
Yeah, well, that's very interesting, but unfortunately, we didn't include any way to control for that. But you are completely right. So probably they are informed, and then their decision was also more informed than the others. So, yeah, but it's very interesting. But we couldn't analyze this selection effect with the questions that we have. But thank you very much. Thank you.
Thank you, Cassandra. Thank you, Ixchel. Yes, we have the next question. Reiko, please.
Thank you very much for very interesting presentation. I don't know whether I can understand the result very well, but how can I say? So, do the effect of knowledge on the legislation on the dependent variable differ between the upward accountability and the downward accountability? Is it both positive and the effect side is the same?
Yes. In both dependent variables, the effect is the same and positive. Yeah.
Okay,
So the more knowledge, the more perceived knowledge, a better perception of accountability.
So why do you think that people with knowledge of the system have positive evaluation, both types of the accountability? So what do you think the relationship between upward accountability and downward accountability among people with knowledge? So for the knowledge, people with the knowledge, do you think the distinction between the two types of the accountability will disappear?
Well, actually, in the hypothesis that we have, we expected the opposite. So the more knowledge, they will be more critical about the information, they will be more demanding. And when we were writing the paper, so we need to identify a potential explanation of this. And what we think is that if they know about the legislation, so they are more aware about the lack of resources, or they are more aware about the efforts that the nursing homes make in terms of accountability, because there are many constraints in different dimensions, socioeconomic constraints, and the budget in which these services operate. So the interpretation that we include in the paper is that the more knowledge is associated with being more aware about the restrictions of the services, and they are more positive about the effort to be accountable. That's the interpretation that we included in the paper. But I don't know, maybe we can discuss more about this. Thank you very much, Reiko.
Thank you very much, Reiko. Thank you very much, Ixchel. Adelina, please.
Yeah, this is more of a curiosity question. So I don't know if it's right, but I had the a priori that in some regions in Spain, there's many more public providers than others. For example, I know a bit more in the Basque Country that I think Álava has a very high percentage of public homes, whereas in other regions, almost all the care homes are now private. And I wondered whether this effect might have played a role somehow, and whether that's something to explore.
Yes. In a different paper, I don't have the numbers in my mind, but there are differences across regions. Some regions are the participation of the market is almost 90% or 80%, and some other regions the participation of the market is lower. Since we will be conducting a third wave of the survey, so maybe this is a variable that we can explore, the extent to which there is the percentage of the market participation across regions as a control variable. So that would be very interesting. Yeah.
Yeah, and one more question, Leonid, please.
It just occurred to me that there is a very interesting question that you might want to explore. Some literature suggests that more intense interaction of residents with their relatives improves the quality of care. In other words, the more closely nursing home residents stay in touch with their relatives, with their loved ones, the better off they are. And it occurs to me that there might be two possible mechanisms which explain this association. The first one is just social involvement with relatives improves the quality of life. People don't feel abandoned, they are more comfortable, and as a result, their outcomes are better. And the second one is that this communication strengthens downward accountability. In other words, relatives, when they visit, they see what's going on, and they can raise their voice to address problems that they see. So both of these mechanisms work in the same direction. It might be interesting and curious to find out what roles they play. If you can separate one from the other, it might be a very interesting study, because the overall findings that more intense communication with relatives improves the quality of care does not really tell you which of these mechanisms play a role and how big a role each of them has.
Yeah. Thank you very much, Leonid, for your suggestion. In the survey, we have two questions. One that is that refers to the level of interaction with the resident. So to what extent they have interaction either by phone, by in person, and the frequency of this interaction with the relative. And we also included another question in terms of the interaction with the staff. And what we are trying to investigate is whether there are differences in these two types of interactions with the relative and the staff. But thank you very much, because this is super interesting, Leonid. Thank you very much.
Okay. Yeah. Thank you everyone for the beneficial discussion. Definitely, our seminar's time has come to an end, so we need to finish our webinar. So, but we would be happy to see you on our next webinar. So thanks a lot for everyone, and see you next time.